Hi, I'm Dr. Amber. I'm a small animal rehabilitation veterinarian who specializes in advanced aging and senior pet care. And today I wanted to talk about how to tell if your pet is in pain or not. This one I get all the time, especially working in rehab. We have some dogs present who are crying and yelling and everything you do seems painful. And then we have others that present where you know they have to be painful the way they're moving, but they don't complain about anything. So, really simple. There's some technical ways, and then there's some kind of tricks of the trade I use. So, first, I typically use the Colorado pain scale. So, it has a 0 to 4. What I love about this one is it's nice and easy. It's a 0 to 4, and it has even pictures of how the dog's posture might change, and it has specific descriptors of what you would call a 0, a 1, a 2, a 3, and a 4. So it's very obvious where you are in this line. I think this one is a nice grip for if you come in with your dog as a 4 and he's a 2 in 48 hours, at least we know we're making some headway. This is a universal scale that a lot of clinics use to quantify pain. Now, if you have a cat, cats are kind of cool. Cats actually have a feline grimace scale, and basically you can look at their ear position, their nose, their eyes, their head height, and that can help you quantify, again, pain in cats. We can't translate this the same to dogs because all dogs' head shapes and faces are different, but this is a nice way to do it, especially if you're chronic, aging, arthritic cats. And then third, the one I like to use, especially in the beginning of rehab, is something called the Canine Brief Pain Inventory. It's a set of 10 questions. My owners answer them. And it's a nice way to have something that you start with and then you can follow over time. But it looks at good days, bad days, averages, how they're moving. So this is, again, a nice quantifiable way to circle and have data that you can follow. Now, other things I use. One is, how easy is it for them to stand up? How easy is it for them to sit down? The speed in which a dog stands up and gets down is also quantifiable. I can time that and see if they look painful and if they're improving over time. Sometimes how their posture, their head carriage, if they don't want you to touch parts of them, they don't necessarily growl or cry, they just move away from you. That's another way to tell they're painful. A lot of times I also watch their ears or their facial expressions. For some dogs, I can tell their knee is painful if I don't get any response during exam, but when I get near their knee, they turn their head, they start to look at me. Or licking, they start to lick their wrist or their paws when you're touching something painful. You're basically they're displacing their discomfort into floor licking, foot licking, belly licking, moving away. So there is no cut and dry way to tell if your pet is painful. You do need to trust your gut. Most of us have these dogs for 10, 12, 14, 20 years. If they've never had a behavior and all of a sudden they have it, or they've never not let you touch their back or their rump or their tail, there is probably pain there and you should trust that. Now, one of the other big things I do want to bring up is, as a rehab vet, as a senior pet vet, and most vets in general, you don't have to cause pain to find pain in an animal. And I know that is one thing where I have my clients come in and they're so afraid for me to look at the dog because I might hurt them while I'm looking at them. And the key is never to cause pain, and I don't have to. I watch the ear pinning, the face comfort, if they're turning, moving, shifting, avoiding. There's lots of ways to tell they're painful without actually having to cause pain. So if you have any questions, feel free to DM me. You can find the Canine Brief Pain Inventory, the Colorado State Pain Scale, and the Facial Grimace Score all online. If you need somebody to send one to you, please DM us. But otherwise, let us know if you have any other questions, and everyone have a great day.